The 2026 health insurance landscape is facing a massive correction. The immediate cause is the expiration of the Enhanced Premium Tax Credits, or EAPTCs, that propped up the market during the pandemic years. Without those federal subsidies cushioning the blow, national enrollment in the Affordable Care Act has plunged, shedding over 1 million people almost immediately. At the exact same time, physician trust in the industry is collapsing. Doctors are citing a surge in opaque, algorithmic medical denials from major payers. These combined factors have created a hostile macro environment where both patients and providers are actively looking for an exit from the established healthcare system. The average number of insurers in each state's ACA marketplace peaked at 9.6 in 2025, but fell to 9.0 in 2026. Corporate retreats drove this drop, with CVS and Aetna pulling out of 17 states. Now, 1/3 of U.S. counties have fewer insurance options. But right in the middle of this massive industry-wide retreat, Oscar Health is suddenly reporting a record-breaking year. This data dashboard tracks their 2026 metrics. Oscar saw a 58% spike in membership, reaching roughly 3.4 million people. They doubled their market share to 30%, and Wall Street reacted, sending their stock price up roughly 170%. These facts raise a very specific question. How is a single company achieving high growth and profitability while the rest of the industry is pulling back from the exact same market? The strategy relies on leaning into the vacuum left by those exiting legacy insurers. As competitors withdrew, Oscar expanded its footprint into 573 counties across 20 states. Then they executed a pricing maneuver, implementing a weighted average rate increase of about 28%. This was a move designed to fix their underlying profit margins. Normally, a sharp rate hike causes members to leave. But because legacy carriers were abandoning the market, there was little competition. Oscar absorbed those displaced members, which offset the churn caused by their own higher prices. This chart breaks down the financial result. The strategy drove their medical loss ratio, the percentage of premiums spent on medical claims, from 75.4% down to a more profitable 70.5%. Looking at this routing flowchart, we can see the operational efficiency. This AI node independently resolves 86% of member questions, bypassing the human agent bottleneck and cutting peak enrollment response times by 67%. However, they operate within a strict compliance framework. To avoid the liabilities of their competitors, Oscar ensures a human is always in the loop to finalize medical denials, adhering to state laws and HIPAA. On top of that tech layer, Oscar launched specific consumer-friendly plans tailored to individual demographics, like their Hello Mino menopause plan, alongside chronic condition packages offering $0 specialist care. By pairing functional, record-aware AI with targeted products, Oscar treats healthcare like a modern consumer subscription, building loyalty that legacy insurers struggle to replicate. The record margins Oscar secured in the ACA market are now fueling a broader strategy. The company is using this capital to position itself for a move away from traditional employer-sponsored group insurance. Under the old B2B healthcare model, employers purchase bulk, one-size-fits-all group plans for their entire workforce, regardless of what individual employees actually need. This flowchart illustrates the legislative mechanism reshaping the market. Enter ICHRA, or Individual Coverage Health Reimbursement Arrangements. ICHRA allows employers to provide their workers with tax-free cash. The employee is then free to take that money and buy their own customized individual plan on the open market. This move places health insurance away from locked B2B corporate contracts and into an open, competitive B2C consumer arena. To prepare for that transition, Oscar made a series of strategic acquisitions, picking up direct enrollment platform Lucy, the agency IHC Specialty Benefits, and the domain healthinsurance.org. Combined, those three acquisitions form the foundational infrastructure for a direct-to-consumer digital health marketplace. This move aligns with their core advantage. Oscar already knows how to treat patients like digital consumers, while utilizing AI to reduce operational bloat out of the system. Oscar Health's 2026 growth indicates that the future of American health insurance is moving away from corporate institutions and toward a hyper-individualized, consumer-driven model.